Hello, I'm Dr. Amoakowaa, Poku, Medical Officer at Superior Medical Center. In honor of Endometriosis Awareness Month, I'd like to tell you a little bit about endometriosis. Basically, the lining of the uterus is known as the endometrium. So when you hear endometriosis, then you know that it has to do with the lining of the uterus. The lining of the uterus has endometrial cells, and these cells have receptors on them that respond to a variety of hormones such as estrogen and progesterone that are found in the body of females. These hormones, as they regulate by increasing and decreasing, they change the structure of the lining of the uterus, either as increasing them in size in preparation for implantation, or shed, which is what you see as the menstruation. So basically, the blood that you see as menstruation is made mostly of the lining of the uterus. Sometimes these endometrial cells might leave the uterus and be implanted on other organs in the pelvis. Organs such as the ovaries, the fallopian tubes, some ligaments in the pelvis, and even the umbilicus. One of the ways by which these cells might be able to leave the uterus and be able to implant in these organs is by retrograde menstruation. Retrograde basically means backwards, which means that your blood is flowing backwards. So your blood will flow from the uterus through the fallopian tubes and into the pelvis. As the blood is leaving, it may take some of the cells with it and cause them to be implanted on these organs. As these cells are implanted on these organs, they go with their receptors. So these cells will also be receptive to the hormones that are regulating the uterus. So in cases where we have high estrogen, where your uterus lining is proliferating or increasing in size, the uterus cells that may be found, for example, on the ovary in ovarian endometriosis will also be increasing in size. So in times where there's bleeding from menstruation, there'll also be bleeding on the ovaries. All of this can cause irritation of the ovaries or the fallopian tubes and cause scarring, which is an important risk factor for infertility. So you may be experiencing lower abdominal pain and might think, okay, this is just has to do with my menses. Anybody that is having recurrent severe abdominal pain, don't just sit there and think, oh, it's just menstrual pain. It's very important that you see a doctor, you see us, we diagnose you and make sure that there's nothing wrong with you and it could just be regular dysmenorrhea, especially if the pain is out of proportion. If you see us, you tell us our symptoms. One of the ways by which we can diagnose you with endometriosis is by doing an ultrasound. It's non-invasive, it's not painful. We just use a probe, look at your pelvic organs and see if you see anything abnormal. So if you have endometriosis, what is next? Endometriosis is not a death sentence. However, it is very important that you diagnose it early if you have it, because as I mentioned, it's a very important cause of infertility. In fact, over half of women that have endometriosis have been diagnosed with infertility or have difficulty achieving pregnancy. If you have endometriosis and if you've been diagnosed with endometriosis, you may be prescribed some medications. Some of these medications will help to alleviate the symptoms. They are not cures, but they'll help you with your pain and other symptoms that may be associated with endometriosis. The definite cure or the definite treatment for endometriosis is by surgery. And you may say, oh doctor, I don't want a large scar on my abdomen. The good news is there's a surgery known as laparoscopic surgery, which can be used to both diagnose and treat endometriosis. Basically, the surgeon will make a small incision on your abdomen and put in a camera so he can visualize the organs in your pelvis, find any abnormalities, and take them out accordingly. This should help to relieve you of your symptoms completely. So yes, if you have any questions about endometriosis, feel free to comment below and I'll be here to answer any questions you have. Thank you.